empathy, and all those beautiful traits we've learned so much about to be able to instill in other people. It's mindset. It's navigating around mindset and getting a person in the right frame of mind so that they can make the right choices, respond accordingly, and start acting for moving forward. Because pace is individual. No matter what pace you move at, as long as you're moving forward, you're growing. Momentum is universal. Pace is individual. So our job as pain providers is actually encouraging people at whatever rate that is to put one step in front of the other, or try and learn from what they're going through. There is always something to learn, and there is always someone or something to be grateful for. In good times and bad, gratitude will always prevail. Thank you. Stop sharing now. Here we go. Smiling faces. Good.
I'm trying to absorb all of that amazing information and that story. I don't know about everybody else. I'm just like completely blown away. Thank you so much for sharing that with us. I think that was very moving for us to hear as health providers, but also just as human beings. That's an absolutely mind-blowing, powerful, captivating, and sort of perspective-changing story. I know that I'm going to be thinking about that going forward when I work with people as a professional, but also just a human being. I want to have this opportunity for people to ask questions or offer comments or whatever you guys want.
I'm
probably the best
answering anything. We're here now. We might as well keep going. I am a bit of a blank canvas.
Wait, Rachel, read Julie's question in the chat.
Okay. Is it for you?
Okay, Julie Tudor. Julie Tudor has a question for you, Jade.
Yes.
Julie says, my understanding is that empathy is sharing the emotions of the other, whereas compassion is a step away from that toward a beneficial neutrality. The idea being that by refraining from feeling your version of another person's emotions, you're better able to aid them to safety. Is that incorrect?
Yeah, look, and I spent, when I did my courses and putting together the leadership course, there are so many definitions that you can search for. But the definition that keeps popping up, and I guess when you go through and look way back to the Latin terminology of compassion, it actually, by definition, when it goes back to the roots of the word and not how it's evolved over time, it means suffering together. So the term, from my perspective and through my research, that comes up time and time again is that compassion is suffering and sharing together, whereas empathy is sort of putting yourself. And as I said, compassion is the action of empathy. Empathy is the emotional sync or connection or the sensation that you feel itself. And compassion is therefore then acting on that. And I guess whatever way you choose to define either of them, as long as your intentions are exactly as you're saying, Julie, if that's what your definition of it is, then that is great. I think in context, what I was saying is that it's the sharing and the suffering together component that ties in with compassion far more than it does with empathy. That is I guess where I have my issue with, and that's because I saw it firsthand, people trying to suffer and to share in my pain is for most people, in my perspective, and I can only talk from my perspective, and my job is to try and trigger curiosity. And even the fact that you're thinking about definitions of empathy versus compassion, I think is really important. I guess that's my goal. And you can go away and, please do your own research and come back and go, look, she totally got it wrong. But I guess I've looked up a lot of definitions on this, and there is common things occur commonly, and the common thread with compassion is sharing, whereas with empathy it's more stepping into other people's shoes and I guess maybe it could be sharing the emotion but not sharing the pain or the suffering component. So I think empathy is far more emotion, and compassion is the suffering pain component, which is what I think is wrong in context, or not necessarily wrong, confused would be the word. And I think getting clarity on these definitions will make you a better practitioner. And I, for one in particular, just having an awareness of the fact that there even is a blurred line between the two is enough. Because if you're a pain practitioner and you're lecturing in empathy and you're lecturing in compassion, you really need to know what these definitions are before you're teaching others and passing on a legacy that may be a little bit blurred.
Sorry, Amber, do you feel that the student that had the moment of holding your hand was feeling empathy rather than compassion?
I think that student himself was the first one that empathized with me, because he had a grandmother that experienced the same thing. So he didn't share my pain. He shared and empathized with my story. And therefore he could connect with me because he'd been through that. So he could truly put himself in my shoes because of what he'd experienced before. But, was he, my friends were the compassionate ones. They were the ones that walked in and burst into tears because they were hurting by seeing me like that. They saw, half of my head shaved. And the photo that I showed you wasn't, that was after a while. I didn't show you the really aggressive one because it's a bit in your face. But they just, and again, they just shaved half my head. I would have rather they'd shaved all my head. They just shaved one side and left this whole, we had a joke that I kind of had this new hairdo. And I guess, moving forward, as it started to grow, I used to always sweep my hair over to one side, and I had this alsaplat, I called it, because I would cover up that side of my head until this side grew long enough and I went into that mum bob. But they didn't tell me these things. They also didn't tell me that did you guys know, I didn't, you don't have any medication whatsoever after brain surgery. None. They gave me Panadol. It was like taking a cough lolly. So they cut that far into my head. And so my surgery, and this was the other horrifying thing, I went in for my surgery at 9 a.m. and I was meant to come out at 3 p.m. They said it was a 6-hour surgery. Now, by 7 o'clock that night, I still wasn't out. And no one communicated with my husband. No one told him why it was taking longer. I went through 2 break shifts in Teams for that time, and my beautiful neurologist didn't rest for 1 second. He didn't leave my side for 1 second. Most surgeons out of a 3-hour surgery will take a break and have another surgeon come in. He didn't leave my side. But they didn't tell me. They didn't tell me I'd have no pain relief whatsoever. So by 3 a.m. that night, I was climbing walls and I was crying and I was screaming, and I just said, my pain is a 10 out of 10. You've cut into my head and you're giving me Panadol. And the nurses were just like, I'm so sorry, we can't give you anything because we don't want anything to mask the possible neurological effects of the surgery. We need to have you totally clear. We can't give you any even happy gas. No one told me that. No one told me that. So I think communication is a real lesson here as well. I think we get so comfortable doing things over and over that with repetition, we become desensitized to things. And these nurses and this neurology team and this aftercare, they do it all day, every day. That often they lose that sense of empathy and they don't put themselves into my shoes. I'd never been in surgery before. So I think that would have helped if I'd had better communication.
I have so many questions, but I know Shaliza has a question and has been waiting. Shaliza, go ahead.
I wanted to actually just make a comment. First of all, I love the idea. I think we should all do that, is look at the core meaning of words. I do that with patients all the way, even with endorphin, right? Endo meaning inside, orphan being painkiller, and how endorphins are used in pain management versus M-orphin, man-made painkillers, right? So in general, I love that concept. I'm struggling a little bit between the empathy and the compassion. I'll have to think about it because it's obviously, I love your reframing on it, but where I'm struggling with it is, I think, in the realm of grief. So having experienced it since you've been so open with self-disclosure, think it was about a year and a half ago, my mother died in a very, very traumatic accident. And if I had not had self-compassion, I don't know how I would have gotten through that grief. So there were many times where I could have been brought to my knees like a child. And if I didn't hold self-compassion in my heart, I don't know that I would have gotten through that journey. So I'm sort of curious to hear other people's comments, or even just how that comes into play.
I think on that, firstly, I'm really sorry to hear about your mother. Compassion from immediate family and people who love and adore you, absolutely. Absolutely, compassion has a role. It's the practitioner sense. And I think it's the going above and beyond. When you don't have that personal connection with someone, do we need to be going that far and actioning empathy? Is empathy enough for allied health practitioners without having to action empathy as compassion? In family, absolutely. Did it hurt me that they were sharing in my pain? Yes, it broke my heart, but would I have it any other way? No. Would I stop their journey and their need for grief and their need for compassion? Absolutely not. I guess in the sense, to give some clarity, I don't want to take compassion away from the world. It is so important. What I'm saying is, by not defining it with medical practitioners and health practitioners, we can overstep that mark and we can carry burdens of patients that will cause us to burn out. And I think we're at risk of, if we blur that line, that's where burnout comes from, when you take these stories home and you can't let it go because you're sharing. And some of the, don't get me wrong, some of the most incredible physicians and practitioners show compassion, but they know how to deal with it. They know how to ground themselves. They're taught to let it go. They're taught to separate. And they're actually taught and trained how to actually stop. These young junior medical practitioners need to learn empathy first before they can be equipped with their personal growth of being able to step across to compassion. And so, Shaliza, absolutely, in your instance, yes, feel compassion. It's the only way.
I agree with you, actually. I think I like the distinction you're making, that it's a lot more sustainable as providers and won't lead to as much burnout if we're kind of more on the side of empathy versus compassion. Yeah. So I see the distinction you're making, and I agree.
And when it comes to family, you feel compassion for family, you'll never burn out. You'll never stop for somebody you love. There is no off switch there. You actually can't override that. When somebody you love is suffering, you suffer with them. But for somebody you don't know, do you have to suffer with them? You show empathy, yes, but that compassion, you save that for instances where you can't do anything but offer compassion. But if we spread compassion across everybody, we're going to get exhausted. It's exhausting in what we do.
Now you're going to have to put a whole course together to teach people that, because if you're just wired to naturally fall into that, it's so
I do, and that's part of my leadership course, is defining the difference between empathy and compassion.
Good.
And it is a new form of framing, and the world hasn't heard it, and I'm really nervous to be delivering it. But I think with the background of the story behind it, and true storytelling RX to actually define the difference, you'll get a better result. So I'm sorry if I didn't make that more clear when I was really...
No, you defined it very clearly. You were very easy to follow, so thank you. Yeah.
Yeah. Alison?
We can't hear you, Alison.
Oh, there we go.
We can't hear you.
Okay. Oh, now good. Okay, sorry. Okay, mostly a comment, I guess, but I was struck by your entire story and the way that you share, and thank you. One of the parts that sticks out for me when we talk about pain mastery is that how many times were you kind of asked, like, are you sure? Or just all the times that all people needed to do was say, I believe you. It doesn't fit the pattern that I'm taught or what I'm told is the majority of cases, but I believe, I entertain the possibility that your experience is valid. And I think that, it's so dramatic in a life or death case. And yet we also see it with chronic back pain that we don't really know how it started, and how often do patients come in really feeling like they have to defend their story, and because they are not believed, or are you sure that was a side effect? Most people have different side effects, or just all the ways that even if the practitioner maybe doesn't realize they're doing it, they're just not validating their experience, and people probably feel on guard. And yeah, it just kind of stressed for me that believe your patients, believe, the human being in front of you, even if it's not what you expect or doesn't fit where you thought you were going. It's just, that's the revolution. Goodness. Thank you.
And that the beautiful way that you put it and the word that you used was validation. I desperately was seeking validation on two fronts, validating the emotions that I felt and validating the pain that I felt. Welcome biopsychosocial pattern. Yeah, I desperately wanted the recognition that I was okay to feel what I felt. I was okay to cry when I wanted to cry, but you know what? When I wanted to be positive and be strong, that was okay too, without being told you're being abnormal for being overly positive in this instance. And you're repressing postnatal depression. I mean, it's sort of scary in that context, but yeah, validation, absolutely. And I guess to his credit, the physician, who was a renal physician at the time, who came in on the code blue because he was the closest to me, came in 4 days later and apologised to me. He said, I remember saying to you, I think that this is in your head and an adverse effect of pregnancy hormones. And he said, I am sorry. And I think that was more powerful for him than it was for me, actually. So, yeah, I mean, that was really nice too. But, beautiful. My obstetrician came and visited me after my surgery on her day off. The woman who delivered my baby came in to see me as a visitor. And that meant so much to me as well. It's the little things. It's the little things that are the big things more than anything. So, yeah.
So I'm sitting here on my computer looking the definitions of compassion and empathy up. And they've got this beautiful picture of this little girl holding her knee and being hugged by probably her little brother. In both words, the same picture. One describing empathy and one describing compassion. They're using the same picture.
Yeah.
That's how, where these words actually end and begin, right?
Yeah. And I think that's the beauty of storytelling, is often definitions are irrelevant when it comes to communication and delivery. And I think it's more part of my purpose, I guess, when it comes to teaching and passing it on to other people. Evidence-based medicine suggests that we have to go to definitions, but we as human beings know that experience is what empowers us, and the lessons that we learn are what empowers us. So I guess it's just a trigger to, yeah, Rachel?
I have a question, and it's to Allison. Allison's question, or her really good point. I mean, as psychologists, validation is a thing that you are taught as it's an actual technique. You reflect back to the patient that you heard what they said, and you validate their words, and validation is woven in. And I'm not saying all psychologists or therapists do that, because they don't, but it is part of the training. And I'm wondering, in different disciplines, is validating the patient part of the training? Because it seems like it's not. Because Sarah Williams, who's on this call, is also a pain psychologist, and it, from her comments, we're both thinking along the lines of validation is a thing that's woven into your training. But I get the sense that if you're in any other discipline,
yeah, and it's the same. Yeah. Validation, and also because empathy is the same. When was the last time you?
I can only speak.
Oh, yep. Amber?
Amber, was that you?
Oh, sorry. I was just going to agree with you. I was just going to say, I'm going to speak from my experience as a PT, that was not part of my training. And I learned that from all of my mental therapy friends and colleagues. That's who I learned to do that from. And it was a game changer. So it was not part of my training.
Yeah. And I think that, there are certain human traits that are learned through mirroring and mentoring. And, but we don't say it enough, particularly empathy. There's some great practitioners out there that offer incredible empathy. But how often do we say to our colleagues, you're a great empathizer? you don't say it. It's almost sort of assumed. But as I said, if it can be learned, it can be taught. And I'll pass on to Rachel. There's probably about 12 papers where they are now starting to teach empathy through course modules, and the way that we kind of do that. But the other thing is we don't want to over teach empathy as well, because we don't want to take away from that, I guess, the genuine nature of being empathetic as well. The behaviors of it are sort of learned through your personality, but the skill side of it, you learn through mirroring. And I think the same thing with that validation. Just by simply mirroring the words of somebody else, you're validating what they're saying. I feel it in my shoulder. Oh, you feel it in your shoulder. Yeah. Or this makes me really, really afraid when I feel this. Oh, you're so afraid. Like, mirroring is so important when it comes to validation. And that is what empathy is. It's a part of empathy is mirroring. We teach empathy through mirroring, and you do that verbally and you do that behaviorally.
I wanted to add real quick to that, if it's okay, that I'm a PA, physician assistant. I started out in primary care, and I've also done some outpatient physical medicine and rehab. And at least in my training, I did not get the validation first. I think it's a really unfortunate thing sometimes in medical culture that, if anything, I think it makes providers sometimes almost defensive, or like, oh, the patient's being difficult. Maybe they read too much on WebMD, or they're coming in, or they don't, or, most of my patients love that procedure. So, okay, it didn't work for that one. And it's almost like an excuse to dismiss rather than validate and say, okay, then what else do we have to do? And if I of course think it should be taught more. I learned it more in some mental health focused training, and of all things, yoga training afterwards, but it was not a part, unfortunately, of my initial medical education. And I agree that it should be. It's a revolution right there.
Yeah. I think, as you say, Amber, understanding the patient experiences is really important. And that understanding is being in sync with them, which is empathy. And, I think that to highlight the importance of teaching empathy is, and I've got a whole module on it. When you guys are within this group, I'm more than happy to share my, the growth, the professional growth that I use in my courses to teach empathy. And it is hugely evidence-based now. But the evidence usually supports teaching empathy rather than compassion. When you actually go through and look through the research, there's very little research to show teaching compassion, but there is a huge amount in teaching empathy. And that makes me a little bit happier, I suppose. But I think it should be part of coursework. It should be part of a university level. And I teach it as opposed to part of postgraduate training to osteopaths in their first 3 years out. And I also teach it in their final year subject at Victoria University, which is nice. It's a really nice subject to deliver.
I have a question. I want to say thank you, Jade. Like, to hear that was the first time that you shared your story with strangers, as you said, like, that was so powerful. Thank you for being vulnerable, and it was just incredible. And I will be your committee cheerleader chairperson for the TED Talk. So just anybody, we've got a lot of people on this call. Someone's got to know someone who knows someone who organizes TED Talks. So let's make this happen. So thank you, and an amazing story. And my question is, so love the definition of empathy, the comparison with compassion. Do you have a definition for sympathy? Because I know sympathy and empathy can get confused as well. And I'm curious about your thoughts about that definition.
I think sympathy is usually a little bit more when you are removing emotion from it. And sympathy is a bit more offered as a gesture. So you think about, I guess, by definition, like a sympathy card. You can buy a sympathy card to actually show that you have acknowledged what somebody is going through. Empathy is E for emotion. You are actually putting yourself in their shoes and trying to understand the emotion they're going through. Sympathy is extending the gesture. of what they're going through. I would say, but again, I've kind of been a bit put on the spot. Usually I'm good with definitions. And I promise you.
That was a great definition.
So yeah, I think that this is why we give a sympathy card, because we're not in a position where, and often I think sympathy is okay when it's too weird to be empathetic. If you're not paid to be empathetic, then you kind of become a creep, right? So you can offer a sympathy card, because if you call somebody up and go, I empathize with you in your situation, they're like, oh, I don't really know you. So empathy you're usually paid for, it's part of your role, and it's usually welcomed. Sympathy is an offering or a gesture you give, I guess, without necessarily being in a position where you should do that. And it's really nice. Offering sympathy is a really nice thing to do. Yeah.
There's a time and a place for that. Yeah, but I appreciate, like, in that professional interaction, you know, with your practitioner, that's something that you really, really want that empathy.
Yeah.
I think, you know,
you give empathy to a patient, but if their family member or their partner passes away, you'll offer a sympathy card, because you don't want to put yourself in their shoes of feeling what they feel when their husband's passed away. That's kind of overstepping a line. You offer sympathy there, because offering emotional support is a bit too far, unless you're, you know, paid to do so. Or, you know,
yeah. No, that's great. Thank you.
So Tanya, how much of empathy is considered nature versus nurture, or both? I think it's I think with empathy, and when we say nature versus nurture, is it, and maybe I'm getting this wrong here, but they say leaders are born, but they're also made. You know, there is also a part of, you know, being born a great empathizer just through your personality, but then learning it by default through mirroring and observation and mentoring. And so I think the nurturing side is the gift that we get from our parents and our environment and our upbringing. And the nature side is something that you can change and evolve through professional development. I think you can become better at nurturing, but by nature, sorry, I've confused that. So your nurturing side is the side of you that is your personality. It's the you know, the personality that you are, or the person you are as a practitioner you will be. But the nature side of it, I guess, yeah, comes through evolution and environmental factors and learning.
So just a technical question for the psychologists then. If compassion and empathy are teachable, then what do you do with a sociopath or those kinds of people who don't have any?
I knew this was coming up, and I researched it last night because I am not a psychologist, and I knew one of you would hit me with it. So when it comes to sociopaths, this is usually ingrained, and I'm not a psychologist, I'm only telling you what I read, and I get excited that I get to answer this question. Usually sociopathic is where that empathetic side or that nurturing side of a child is usually established at some point before the age of 2. And so if they're taken away from that environment, there is a part of their brain that actually blocks that connection and actually blocks that empathetic and compassionate nature, in which case it's very, very, very hard to actually be able to trigger that part of the brain that has almost been cut off. So in answer to that question in regards to teaching that is a far more scientific process in regards to neural remapping and neural processes and pathways. There's a lot of people that argue that you can't do it. Obviously, it's way out of my scope of practice, but that comes down to a second step across. So firstly, people who are capable of learning empathy first are the ones we need to teach. Sociopaths, that's for you guys. Good luck. If that part of their brain is cut off, from the 2 articles that I read through last night, the empathetic part is what most psychologists and psychiatrists strive to instill in sociopaths. Has it been achieved? Sometimes sociopaths are so smart that they can tell you what you want to hear. You know, that's a whole can of worms. That's a whole new thing. I mean, I think I watch too much true crime, which is probably why I get a bit excited about that. But yeah, look, in answer to that, I think if you are teachable, you can be taught, and I don't believe that sociopaths fall into that category.
Okay, so I just want to be mindful of time. I actually totally lost track of time. So if people want to hang out and stay, you sure can. But I do want to say before people drop off, I just want to say thank you to Jade. This was really powerful and moving, and a really wonderful sort of wake up call for me at least. And we really appreciate you being vulnerable with us and telling your story. I think it's really powerful. So we will see you all next week. And if folks want to hang out, of course you can. But thank you, Jade. That was really special.
Thank you. I've at least got 25 more gratitudists, right? Yep. Yeah. And look, when I release my book, I'd love you guys to read it and, hopefully give me some feedback. And what a part of growth as well is really constructive feedback. And if you do have some feedback for me, and if this is something that I'm going to start delivering, I would love to get some feedback. If there's things that triggered you that I have said that I would like to learn from that before I continue to deliver this. But thank you for your time. I'm in true words of gratitude. So I'm really grateful. Thank you.
Thank you, Jade.
Thank you. I had another thought that I felt like sharing, if everybody's okay with that, which is that I've been chewing on the whole empathy piece, and it's funny because in physical therapy, I feel like there's like a subsection of people that are using the biopsychosocial model, but there's still a lot of therapists that I think are sort of, they don't like to work with people who have chronic pain, or they find them challenging and difficult. And they kind of look towards me, because I do enjoy working with that population, as having some kind of like a special magic, or like they'll make comments of like, oh, you're really good with that type of person, or things like that. And I think all it is just that I've learned to have empathy. Like, I actually think that's all it is. And so if we can just train more clinicians, like, again, I didn't get that as part of my PT school, but if we could get more of that, then I think it would make such a difference in the chronic pain world. Yeah. So this message, I think, is really helpful for, teaching people empathy is important.
Thank you. I've got a blog that I release next week on empathy, and it's called Above All Empathy. Of all the traits as a health practitioner that we need to be able to deliver out to our patients, above all, it needs to be empathy. It is the most powerful behavior, skill, and attribute we can deliver through our quality of care that we're providing. And I think it's really important to be able to push that message, because we even want our colleagues to be highlighting that as well. Deanna?
Yes, thank you. That was amazing. I actually still have goosebumps. You are such a beautiful storyteller. But what I'm getting really excited about is the whole empathy piece around not just the clinicians, but also partners. So those who are living in chronic pain, and their family members and their partners. And, how often we hear they really struggle with communicating with their loved ones. And I think empathy is such a big piece of that. And so I'm wondering, is your next step perhaps take it beyond the clinicians? And is that too much work? Too much time?
Do you know what? I really value the role of a psychologist. And I think psychologists do wonderful things. And I think whilst my passion and my purpose at the moment is in leadership, I think stepping into that helping and the responsibility and that sort of stuff, I think needs to be left with the experts. My job, I feel like, in leadership is to empower psychologists to do better and be better across that. And I guess if that side of empathy helps carry across to helping partners and personal trainers and physical therapists, then that's great. But I think there's certain things where I've got to be careful not to step outside my scope of practice. But if I can help lead that mindset change, then that would make me really, really happy. But even the fact that it's triggered that thought process, I feel like I've done my job there enough as well. So yeah, thank you though.
This whole group is awesome, really. So thank you, Rachel, and thank you, Jade, as well.
I'll leave you to it. I'm stepping away. I've got 2 little kids downstairs who I can start to hear screaming and crying. I do have another little boy. He's 2.5. They told me not to have any more kids, and I was like, you don't know who I am. So I did have another one. And so, yeah, little Lacey and Leo downstairs, and we're allowed out in Australia. We're allowed to go visit one family. So we're going to see people for the first weekend in a really long time. So I wish you all the best. Thank you so much for listening. I hope you did take a bit from that, and it was lovely to meet you. Please connect with me. Please join the Growth RX group. I would love to have you. And again, a huge thank you to you, Rachel, before I go away. I love that I've connected with you. You're a big, beautiful soul doing great things. And Michael Mannix, my boy's there. One of the guys from my team is logged in. Hey Mannix, you've got your camera off. Hey, this guy helped captain my ship while I was sick. Thank you. He ran my business, right? Okay, see you later, guys. Bye.
Bye, everybody.
Great. Thank you.
Bye.